What did I do? Okay, hello everyone. Can you hear me? Yep, is that?
You good now?
Oh, okay. And okay, great. Thanks, Rick. So aloha everyone to the Kupuna Caucus. It is 2 o'clock, so we are going to begin our meeting. I see here Representative Corey Chun, my co-convener, is also with us, so we'll begin. Today, we're fortunate to have Gary Powell, who's going to talk to us about the Caregiver Foundation. Gary, are you on? Are you here? Gary's not here yet. Let's see. Okay, Gary is supposed to be joining us to tell us about the Caregiver Foundation. Well, since he's not here yet, I'm going to use this time to just remind you. Oh, Gary, are you here? No. Okay. To remind you about one of the big functions of our Kupuna Caucus is to put together our legislative proposal package of bills. We were very successful last year, and I think that everybody working together has been really helpful for us to get a lot of big bills passed last year. So what I have up here is our deadlines for different the proposals as well as the voting, so that everybody can kind of take down these dates. We would like to have your proposals. We're starting early because we need to, at the end of the day, we need to put the proposals into a draft bill, which we send to our drafting agency. So if you can send in proposals, at least a concept and what you want to see in a bill by September 25th to us, that would be most helpful. And then we would have October, we would list all of those bills or bill concepts at our October 2nd meeting, where we will have the presentations of whomever wants to present their proposal and explain it and answer questions. We will have time at the October 2nd meeting. And then the voting will start then. And then at the voting will close on October 30th. And we will then count the votes. And at our November 6th meeting, we will approve the package. We will share with you what came in and the votes. Are there any questions? Rep Chun, you want to add anything to that?
Nope. Sounds good, yeah.
Okay. Yeah, it's worked really well all these years. So you know, the more you can think through what include bills that didn't pass last year that you want to see, you know, try again. We keep trying and they do pass after a while. So please you know, take heed of these dates and please send your proposals. It doesn't have to be a fully blown draft bill, but at least the ideas of why the problem, what's the problem, what is the bill trying to address, how will the bill address it, something like that. And if you send that to us, we could put that together in a list of bills or potential bills to be drafted and part of our package. Okay. Any questions? I don't see any hands. Anybody want to add anything to that? Because you've all been part of this for quite some time now. So you know the drill, most of you. Okay. Is Gary here? No? Okay. Well, Corey, you have a joke?
Senator, I believe Gary
Yeah.
should be online.
Gary's on.
Oh, Gary, are you here, Gary?
Oh, now I figured out how to unmute it. Yes, I am.
Oh, yes. Okay.
Sorry.
Okay, yes, please, proceed. So Gary, thank you for joining us. We'd like to hear what your programs are, we're all ears. You've done a lot with
Okay.
your Caregiver Foundation, so we'll
Great.
have some time for questions and answers, but why don't you tell us about the Caregiver Foundation?
Okay. Could I share my screen?
Sure, yes.
Let's see if I can figure out how to do that.
I think
Okay,
it says share at the bottom, or I don't know if your
Okay.
screen has it at the bottom.
Can you see that?
Almost, yes, yes.
Okay. So,
You could- Alex, do we enlarge it or does Gary enlarge his? Make the screen bigger.
how's that?
It's Alex, can you enlarge that?
Gary, if you want to click on the display settings, I believe at the top left.
Up left. The taskbar. Oh, display settings. Okay.
Yes. And swap presenter view and slideshow. There you go.
Oh, I learned something. Technology and I are not quite enemies, but we get close. Well, thank you for letting me come and join you folks and share a little bit about the Caregiver Foundation. It's a complicated explanation of what we are because we cover such a vast array of areas for individuals and for organizations. We're a 501c3 not-for-profit, but we're unusual in that we are self-sustaining not-for-profit. What that means is that we have a fee schedule for most of the things that we do for individuals. Some people say, well, how do you do that? You're a nonprofit. Well, nonprofit doesn't mean no profit. It means not for profit. So any technical profit that is realized from our fee structure goes to pay the ongoing operational costs of the organization. So to tell you a little bit about what we are and what we do, I'm going to share with you some of the ways that we work with families and with individuals in helping them try to make life a little bit better, because that's our ultimate goal. We work with seniors and with adults with disabilities and their caregivers in almost every aspect of life you can imagine. That means their financial life, their legal areas, their practical home life, care needs, placement, staffing, whatever it is that is needed. We work with them, coordinating, sometimes providing service, sometimes bringing other service in, sometimes working with government resources, sometimes working with private resources, all in an effort to try and make life better for them. So why do we do it? Well, we have a real concern for people. I've been in the caregiving arena since I was about 13. And it seems like every time I turned around in my life, I was involved in caregiving. And now I have the great privilege of being able to do it full time for the past 20 years with the Caregiver Foundation. So from a technical point of view, we're 501c3. We've got a 15-member board of directors. We have a 5-member, I think that's a 7-member advisory board. And we have 8 staff on headquartered here on Oahu. But we serve clients on every island except Niihau. So what we do is provide things like financial management, daily money management, good old thing called forensic accounting. That's especially important in the field where dementia seems to take away all our memories of what we have. Managing people's budget, helping people when resources are simply not there anymore, helping them figure out how to help get Medicaid or other government benefits. The care management side, we work on finding the right place to live. Everybody wants to live at home, but not everybody can live at home safely and effectively. So sometimes placement assistance is needed. We work on staffing management. That's a nice term for, do you have somebody to cut the yard if you're living at home? Somebody to come in and change the light bulbs, somebody to cook, somebody to clean. And then the health and welfare. Are you making it to the doctors? Do you need somebody coming in to manage your medications? What is it that you need? We try to work on finding that and resolving those. And then toward the end of life, we provide coordination with hospice. We're often there at the bedside of someone that passes because there's nobody else in their life. Many of our clients have had spouses who've passed. Their kids are far away or they don't have any kids. And many of them have outlived all their friends. And so sometimes we're the only hand that they have to hold as they exit this life. And we're honored to be able to serve in that capacity. When someone does pass, we're often in charge of managing their estate, whether that's managing a trust for them, serving as personal representative, cleaning up the place, figuring out how to liquidate everything, and handling all of the distributions, or sometimes acting as an agent for the trustee who either doesn't want to handle all the details or simply has no experience in it and needs a lot of guidance in managing the estate properly. And we do a bunch of stuff like guardianship and conservatorship. That's a real important part. We often get calls from the court. It's very embarrassing when we get it right from the judge's chambers because we don't know how to say no to the judge. So we get some very interesting cases. We have a product that we call standby service. This is especially useful for people who may not have anybody involved or may not want to have anybody involved in their estate or trust or managing their affairs, but they don't need any help right now. But they're worried about what would happen if something happened to them and they had a stroke, who would take care of things? Or they have a disabled child that they're worried about. Who would step in and be able to be nominated as that child's guardian or conservator? We're able to set everything up in advance and then maintain it year by year. Sometimes a person will pass and then all we're doing is managing their estate. More times a person becomes disabled in one way or another, and we step in to help manage that as well as all of their business affairs and financial affairs and make sure things aren't being exploited and taken advantage of by the hordes of people out there waiting to exploit everybody. We also have the Hawaii Caregivers Pooled Special Needs Trust. This is a unique kind of trust. It allows individuals to put money into this trust, and it moves it out of being an accountable asset to an uncountable asset. There's no age limit on this. The only thing is that it's for people with some form of disability, whether that's mental, cognitive, dementia, physical, whatever kind of disability it is, they are able to use this trust at any age. So even individuals who are over 65, who normally cannot put together a special needs trust, they can join this pooled trust. And of course, there's a whole lot of other stuff too, but we can go into those if you have any questions. So we really are confident in what we do, but we're also very careful to understand that what we do is make promises to people. And many of those promises are in the future. They're going to be fulfilled in the future. So the trust that we have from the families and the clients is very, very precious. And so we have to be very serious about that. That's one of the main reasons that we decided to be a fee-for-service organization, so that we are not grant dependent. We want grants, don't get me wrong. We want grants, we want gifts, we want all of that sort of stuff too, because those allow us to expand services. But when it comes to the operational aspect into the future, we are self-sustaining. Don't have everybody's picture here, but here's some of the folks that we work with. We've got a great crew. 8 of us are on the team right now. We're looking for our 9th position, so if you have any good candidates, let me know. The way that we obtain clients is usually by referral. We do an assessment, we figure out what it is we have that they might be able to benefit from, whether that's a service or just information. A lot of people just call and we are able to connect them with the right parties. We don't tell them call here, call there, we'll make the calls for them. So we work on that. Our referrals come from doctors, from Adult Protective Service, Office of Public Guardian, the courts, communities, community referrals, social workers. Once in a while, we'll have somebody come in just on their own and want to work with us. And sometimes it's family asking us to work with them. We look at the assessment. So what is it? A physical need, mental health need, financial need, community need? What is the situation here? What is it that they need? Is it a service that involves finances or legal affairs? Physical service, mental health services, practical administration, all of these different areas. We try to figure out what it is that is actually needed so that we can either help with that direct need or we can coordinate the help for that direct need. For the legal side, we work with an individual's own legal advisors as much as we can, but if they don't have their own legal advisors and legal advice is needed, then we have a whole bunch of attorneys. Hawaii's got a lot of great attorneys, and we work with them in finding ways to meet those needs. Those needs can be very complex. We're working on a case right now that is extremely complex. It involves very significant exploitation by a professional person of a senior who had extensive assets, but it is so convoluted and difficult to sort out. It's probably going to take another 2 or 3 years to resolve it. But we take on cases that other people don't want to bother with because there are too many people involved, too many conflicts and personalities and family issues. We work with that all the time. We work as a third party, neutral party in managing those affairs, and we've got a good reputation in trying to bring those to conclusion. We don't try to solve the problems. That's not our role. What we try to do is create a bridge so that the issues can be resolved, not the relations. Sometimes we're lucky and we get to rebuild relations, but not too often. Often we're handling the financial management of people's lives. Daily bill paying, money management is one of our services that is very critical to so many people. We do provide a comprehensive financial management that will take into account all their taxes, all their bills. We'll have their mail rerouted to our office, pay everything, make sure everything's accounted for properly, and work with them on that. And then we work with them on being realistic about their budget and their resources. The care that a person needs may not be the care that they can afford. So we have to look at it and say, well, what is it that is needed, and can we find another way to bring that need or meet that need because resources are not adequate? Or we'll work with a person and looking at their resources and saying, guess what? You have to budget. Most people don't like to hear that, but we work with it. When we serve as conservator or guardian, we do get to make those budgets and hold them to it. That always gets interesting when somebody says, but that's my money. I want to spend it the way I want. That's not always possible. But we try to make it as palatable as possible. Comprehensive care management is something that literally encompasses anything that somebody might need. Often we're working with people with dementia, all kinds of dementia, but memory issues put people at risk of exploitation, self-neglect, outright theft, many, many things that they may not cognitively understand as clearly as we wish. Sometimes when the dementia is advanced, it's very obvious that they can't understand. But many times it's not as obvious as people think. Lots of time dementia is well into someone's life, 10 or plus years before anybody can diagnose it. But when we look at the situation and we look back doing the forensic work, we can spot where things started to go wrong, where decisions started to be made that didn't make sense. And then often we're able to go back and try and repair some of that. So when personal care is something that we see, or resources, working with somebody, we see that resources are something that we need to work on. We get in and we're very comprehensive about it. So we're the nosiest people you'll ever find. We want to know everything. We dig until we do find all the information possible so that we can represent our clients in the best way possible. So again, that's just a real fast rundown of what it is we do and how we do it. Oh yeah, that's a good statement. It's very difficult to cover every aspect of the work taken on by the Caregiver Foundation. Everybody's different. We work realistically to figure out what's the best outcome that we can come up with. How can we make life better? How can we make it more secure? How can we make it less anxious? Life's hard enough. Sometimes we need a little bit of help, somebody walking alongside us to make it a little bit easier. So that's a real fast rundown of what it is we are, and I'll stop sharing and be glad to answer any questions that you have that I can.
Okay, thank you, Gary.
You're
Appreciate
welcome.
that. I'm going to ask the participants here for any questions they might have of you and of your organization. The one question oh wait, John McDermott,
Yeah.
please.
Well,
Hey, John.
John,
Hi. So I'm wondering, under the list of services, you had three things that were in bold. I'm just wondering, is there something significant about that? And you also said about, you charge for the various services. So is there a price list? How do people know what services will cost how much?
We'll be glad to send anybody a fee schedule. We do have that. I'm not sure what I had in bold. That could just be that I accidentally made it in bold.
Okay.
Or it may have been important. But I'm not sure what exactly those were. But the three areas that we tend to focus on heavily are the financial, legal, and the practical aspects of care for people.
I'm assuming that you have to work with banks, and sometimes banks can be very strict about giving out information.
Yes.
So how are you able to get them to give you the information that you need?
We usually are serving either as someone's durable power of attorney, their conservator, or their unlimited guardian. And so with those three positions, especially the conservator and the durable power of attorney, we're able to work with the banks, and they most often recognize those. Once in a while, we'll have a problem with it and have to go back to the court and get a court to actually order them to cooperate. But for the most part, they know who we are, and they are used to us now. So they're usually pretty flexible, but we're also very careful not to ask them to bend to any rules. So we don't go in saying, well, just give us an idea of what they have. No, that's not okay. If we don't have the official ability, then we have to wait till we get that authorization.
so regarding the fees, Gary, so what if a person can't afford your fees? You said that it's a not-for-profit, but do you help people who are more indigent, or maybe they have Medicaid, or but how does one get help from you, or do they all have to pay a fee?
It depends. We do have what we call our Pulama Aloha Fund, which is where we raise money to help people who either run out of funds while they're working with us or do not have funds that we're able to work with. But what we'll often do is, if someone isn't going to be able to afford our level of services, we try to work with them in figuring out what is going to work. What can they tie into? And then try and get them into those programs. And we don't like to tell anybody, sorry, we can't help you. What we do is say, well, you might not be able to afford this care, but let's figure out what it is you need. Maybe you don't have as many choices as other people do, but we can usually find something that will help them. And once in a while, we're able to take on a pro bono client. Not very often, because it would impact our operational abilities. So sometimes hospitals will underwrite a client that they have in the hospital, and we'll work with them trying to reduce the fees to bare minimum to help them find somebody, a guardianship or conservatorship, so they can get into a community care home, for instance. Without the legal representation, the hospitals are stuck. They have somebody in a bed that doesn't need a hospital bed, they need a community bed. So sometimes we're able to work with the hospitals in getting them to cover the legal fees, getting an attorney to reduce their fees to come in and help on that situation. And then we work on trying to reduce our fees so we can work those out.
So do most of your clients, are they caregivers or are they the person who needs help?
Most of them are the individual needing the help. So in the disabled community, it's very often their parents that are the initial clients. So somebody has an adult child living with them at home and they're now 70, 80 years old. They're starting to worry, what's going to happen to my child when I die or become disabled? So we're able to put those standby services in place so that there's a transition that they can feel comfortable knowing that somebody's going to be there and step in and actually know what they're doing to help that child.
Okay, any other questions? I don't see any hands.
Well, can I ask about
Yeah.
the role of the board of directors? You mentioned, I think you have maybe like 15. I don't know if they hire you or they do like a annual evaluation or something like that. But you are working with people who are very vulnerable, people who maybe have a lot of money. Certainly, there's the possibility if somebody was dishonest to take advantage of the situation. So I'm just wondering how does your agency have like an annual audit, or is it the board itself that does the monitoring just to make sure that everybody's doing what they're supposed to be doing?
That's a great question. We have several different organizations that watch us. Very often we're working with veterans, so they have their own audit system. Working with the Social Security Administration, they have their own audit system. So we have those going on all the time. Internally, we're constantly auditing what we're doing. The board of directors does have ultimate responsibility, and they do pretty good job on keeping track of what's going on. We also try to work with their own attorneys, their own advisors, and have, as long as the client has capacity and gives us permission, then we're able to bring in someone who would advocate for that individual. And they're able to look at the books and check things and make sure that they're comfortable with everything that's going on. I'll give you an example. We have a gentleman in Waikiki who's decided that he would like to have his trust managed out of California. So we're working with a California trust company, moving the funds that we've been working with over to them and working with the California Special Needs Trust attorney and the California Oversight Board. Kind of keeps our eye on that whole process. So we have about 350 clients. So to do an internal audit on 350 clients would cost an enormous amount of money. So unless someone asks for a specific audit as an individual, then those are done on an annual basis. The books are open to anybody who wants to check them. Like I said, with the ones that are for Social Security and VA, and sometimes other organizations that have bonding requirements or something, then they have a separate system that we're working with. But for the funds of the organization, then the board audits that on an annual basis, and it's reported on a quarterly basis.
In that regard, you, as John says, you've got the vulnerable population that you're serving, and they may have kids that are in dispute as who gets what and like that.
Yes.
How do you get, you're probably in the middle of that. So how do you ferret out, and get some kind of making sure that the person is really being supported by multiple people who are interested in the assets of the person, maybe more than the person, but how do
Yeah.
how do you deal with that?
Well, the first thing we try and do is figure out, have they done any of the legal planning that they needed to do? If they have, then we follow exactly what they have planned through their trust or their will or whatever that was. A lot of people have not done that. We just had a case referred by Kaiser today, a gentleman that's nearing the end of his life and has no one involved with his life and has fairly substantial assets. It's going to be interesting to try and figure out the few people that are in his life, who's in line to get this. So often we'll suspend everything in an estate and then go to the court and get instruction from the court. We'll make our recommendations. Often we'll ask the court to assign a kukulkanavai to come in and help us sort through everything. Some of these are so complicated. And sometimes we have to go in and make really hard choices. We have a case right now involving a lady who passed away. She was giving a house to one kid and a house to another kid, but one of the houses had to be placed on a reverse mortgage to be able to finance her care. So now one of the kids needs to pay that mortgage off or lose the house. He's not happy at all. So, a lot of times we're having to deal with that. So it can get, we had one case where we had to have 2 funerals, an hour apart from each
For one
other.
person?
Yep.
Oh, gee.
We could not help them bridge their hate of each other. So we conducted 2 funerals at the same location, an hour apart.
Oh my.
Hopefully we never have to do that again.
Wow. Okay, anybody else with questions of Gary? Well, I don't see anything.
Yeah, I'm.
Yeah.
I just want to say that I'm going to be meeting with caregiver separately, but I'm very glad to learn about what you're doing.
Well, thank you. Anytime anybody has a question or you have a case or something, some people you know that need some help, feel free to call up and let's talk it over. Maybe we can give you an idea.
So Gary, I don't know if you can write in the chat, but if you can give your email or, you had mentioned earlier your fee schedule, so anybody interested knows where to contact you.
I can give you this. I don't know how to upload anything, so you'll have to contact me and I can send you the fee schedule without any problem. So
yeah, that'll be great.
give you this.
Oh, and while you're doing that, I have another question from Leigh Lermont.
Yes.
Leigh, you have to unmute maybe. Leigh?
Sorry, my camera's not working. I guess the question I had was what you asked. He did not give us the contact information. And I have a friend who was a caretaker for her brother, and she passed away. And now he's mentally not sound, and he's in a care home. And his daughter lives in the mainland. And we don't know of any other family here. The woman that died, she had a daughter, but the daughter died. But the son-in-law and children moved from New York to Florida. So we're trying to see how we can help, but we're not legal people, and we don't have any. And the house was in the mother's trust, and she died. I mean, she's been there a long time. So is that the kind of problem that you can help with?
Probably.
Okay, then maybe I can have the friend of mine that's looking after them. Maybe after you give us our contact information, I can forward it to him.
It's on the chat, Leigh.
What's that?
It's in the chat.
Okay.
Gary, at the caregiver.
Yeah, have them give me a call. We'll talk it over and see if we can't figure out a way to help them.
Okay, thank you.
Thank you. Thank you all, and thank you for all the good work you folks are doing.
Thank you. Thanks for joining us.
Difference.
We appreciate your joining us and telling us about the Caregiver Foundation and the work you do.
Well, thanks again.
All right.
Take care.
Aloha. Okay, you
Bye.
too. Okay, so Jack, are you still on?
I am.
So do you have any announcements about what's going on with you got a lot of different projects this session, but
Yeah.
where you are in it. I know it's pretty early, but also
I'm happy to tell you where we are, and and wrap it up. So SHPTA has, of the 189.8 or something million dollars for rural health transformation that our governor went to bat for us, and we really did score big. SHPTA has the largest amount of money to distribute among the state agencies. There are 6 buckets. 2 of them are at UH. There's 1 at Department of Health, 1 at Department of Human Services, and 2 at SHPTA. We have health information for rural communities, which includes Waianae, Wahiawa to North Shore, and Waimanalawa on this island as well. And we also have, in terms of the information technology projects, of which there are half a dozen, we are also looking at empowering hospitals, health centers, and individual providers to prepare for the AHEAD grant, which begins in January of 2028. And we have a lot of money to do that, so we can help independent practices that are having trouble surviving. We can reach out to rural hospitals. We can do a lot of things, and Kupuna will clearly be part of this. One grant that you're well aware of, Senator, which is Kupuna Aloha. There's money for that pilot project for neighbor islands, and there's money that came generously out of the legislature for urban Kupuna. So we have the 2 parallel pilot projects, which we're going to work out to make sure they're coordinated to see how that project works. For everybody on the call, this is reaching out to beneficiaries who are frail or at risk at home, but have no eligibility for home and community-based services. And these are people that would be pertinent to the last speaker in a sense. They have too much in terms of assets to be Medicaid eligible, but Medicare doesn't pay for home and community-based services unless you're just getting out of the hospital. And so we want to reach to these folks. I might call out Queens. Queens has been providing its own resources to some of these people in Honolulu, in particular, because they kind of bounce in and out of the hospital all the time, and they decided that they would pay for the services just to keep them well at home. But this program would allow volunteers. Some cases it could be community health workers, but oftentimes it'll be a volunteer who might take 1 or 2 patients in their immediate vicinity, in their building that they live in, or in their neighborhood where they can walk, and they volunteer to see the patient once a week and maybe call them up once or twice a week. And we will give them training. We'll, of course, vet them. And then we also give them a laptop, and that is able to connect immediately to an advanced practice nurse or a social worker when these folks have a question that they need answered. That they think there's some need that needs to be addressed. Idea being here that we try to avoid avoidable ED visits and hospitalizations and progression of chronic disease. But also, if we do this right and we measure the results, we should be able to argue with the Medicare program that, like the Unlock San Francisco program, we should get some funding for this from the federal government, because we're going to be saving them money. So, we're looking at it as an interesting project, good for our Kupuna, the majority of whom aren't Medicaid eligible, and good for the families, so good for the families of these folks. And so we're excited about it. It's just a pilot, but I want to thank you very much, Senator, for your helping to champion it, because it's moving forward and we're going to learn from it.
So you also have that, I mean, I know that this is too early in the game, but what your plans are for the hearing one, the hearing plan?
The hearing proposal is moving fast. The University of Hawaii is going to pick it up for us and do the study. Dr. Bareil's office in social services is going to do that for us. They're going to move it fast. We want to be able to come back and talk to all of you on the caucus, but the legislature in general, about finally having an assessment of hearing loss that involves keiki, adults, and kupuna, that looks at where we have gaps in our diagnostic capabilities gaps in our therapeutic capabilities, and other gaps that need to be addressed for hearing loss, which has a lot to do, as you all well know, with problems like falls and other accidents that happen to Kupuna who are dealing with hearing loss that just isn't addressed well. And many people go out and buy hearing aids, but they don't know what frequencies of hearing loss they're dealing with. The hearing aids don't work because they're not designed right. And so we have a lot of work to do in this area. And this study will give us at least a sense of what the unmet needs are and the gaps are, and allow us to then come back and ask for a way to address the deficiencies across the spectrum.
Can you mentioned the AHEAD contract or grant.
Grant, yeah.
Yeah. Remind us again what that is supposed to do and how it might help the Kupuna. I know it's the whole
Sure.
population health thing, but if you can simply tell us what it is and what has to be done before you start up in 2020.
It is a super comprehensive grant to reform health systems across the country. Only 6 states have been awarded the AHEAD grant. There may be 2 more states that come in. They would be red states because we have 6 blue states now. And they're all in the Northeast, but except for Hawaii. The grant would add, it's all voluntary, but it does improve and increase the bottom line for hospitals, for health centers, and for physicians who participate smartly. It adds about $200 million a year to the healthcare funding pie in our state, which is significant. It's twice what we expect to be lost from the Medicaid cuts that came out of HR 1. So it's a lot of money, but it requires people to participate. And more importantly, it's the federal government's wholehearted vision for where healthcare needs to go in the future. It still has some fee-for-service payment in it, but it's mainly moving to a value-based payment model. In other words, fee-for-service rewards volume of care, and value-based payments reward quality of care and population health improvement. So the feds very, very understandably and rightfully want to move to value-based care. It all depends on how it's done and designed, how it works, but it would put the whole state in that kind of a payment model if it moves forward. For Kupuna, it would increase primary care reach and access to people who need that care. And Kupuna often are disconnected from their primary care doctors. And there's very few incentives unless they get in the car or somebody drives them to the office to really take care of them. This program is going to find ways to reach them, even if it's telemedicine, however it works, engage the families. And it also has to include 2 other elements. It has to include an annual assessment of behavioral health related needs the patient may have, which can be depression or social isolation. It also has to address health related social needs that the patient lacks: food insecurity, transportation, access, etc. So it's a program that can help Kupuna a lot, and we want to make sure that we're tracking that we're having progress there. I might just mention that in the legislature this year, an issue that SHPTA championed but unsuccessfully last year was to get the health plans in the state to voluntarily increase the amount of money they spend on primary care. Primary care is a way of reaching everybody, including Kupuna, and it really needs to be a front line of care. And unfortunately, we're spending less and less money on primary care. We're losing our primary care doctors and nurses. Specialists and specialty nursing gets paid much higher, and it's not even attractive to med students. We've got to change that. And the only way to do it is to put more money in there. And the other countries of the world, the other 37 richest countries that join us in the Organization of Economic and Cooperative Development, OECD, all understand this. And they spend 15% or more of their resources on primary care. And in the United States, California and now Massachusetts did what we tried to do last year, which was require that insurers demonstrate with data accurately that they're spending at least 15% of their total spending on primary care, which is very well and clearly known, if it's done right, to reduce overall spending by 20 to 30%, because you're reaching people who otherwise use the emergency department or urgent care. Their chronic conditions get worse. All that just is wrong-minded. So we're trying to awaken to what 37 other rich nations already have learned, and some states are moving toward. And we want to make sure that that reaches to Kupuna as well as all the other patients who need it, including kids and everybody.
Thank you. Anybody with questions on any of these programs? Thank you. Oh, one more. The elephant in the room. When are the hearings on this merger? I'm getting lots of complaints from individuals
I
and
know.
private.
Yeah.
ups.
Well, that is an
there-
elephant in the room. That is an elephant in the room for sure.
Is there like a time frame on, I mean, if you can give us not necessarily,
Yeah,
you know, but
there
at least
is.
what's the, what is the,
So SHPTA, I won't be talking about any of the policies related to this, but I will be talking about the process
the
today.
process? Yeah.
SHPTA has received an application from HMSA and Hawaii Pacific Health for a vertical integration. They call it a partnership. Others will call it a merger. But whatever it is, it requires SHPTA to review it because it's a change of hospital ownership for the 4 HPH hospitals. So they need to come to us, and they have. When they initially came to us, we reviewed it with the Attorney General, and we determined that we did not have enough information. So we then sent back a request for information about 3 weeks ago. We're awaiting the receipt of that information. Presumably it will be complete, sufficient. We will then deem the application complete. And from the moment we do that, we have 90 days or less to make a determination of whether it proceeds, it is denied and doesn't proceed, or whether it proceeds with contingencies that have to be met. So I would say that before October 1, we're going to have a determination. We really would like it to be sooner rather than later, but we will need to have a public hearing process so that every voice that wants to be heard is heard. I would say to you that if you have feelings about it, we can't post or file the application until it's deemed complete. But if you wish to see it and it's compelling, we can provide it to you. We can provide it to legislators because you're state officials. Others will have to pay $36.40 for the massive 300-page copy that we have to make of it. But
is it going to be online, Jack? So is it?
It will be online as soon as it's deemed complete.
Complete? Okay.
So
Can you just put in the chat to where they can find it on your website or wherever it's going to be?
Yes, I will. And it won't be on there until we deem it complete, but
but at least where to look.
Yeah, I will put it in there. I'll put it in there. Sure. Yeah. All right. Thank you for the questions. I appreciate it.
Thank you. Thank you for all that's on your plate.
Oh, don't mention, not to mention we just had a really contentious prior authorization working group today too. Woo! A lot of unhappy insurers in the meeting, but we're working on it.
Okay, well, thank you for your leadership there. Really appreciate it. Do you have any no other questions? Representative Chen, how about you? Do you have anything?
Nope. I don't have anything.
Okay. Any other announcements? Anything else anybody wants to say? If not, this meeting is adjourned. Thank you all so much. for
Happy Aloha
coming.
Friday. Happy
Aloha.
Aloha Friday.
Aloha.
Aloha.
Have a great week.